You're just looking for an assessment, maybe to try and figure out what kind of therapy you need, I would suggest you go to a clinical psychologist who would be able to do an assessment for you. Now, if it's a psychiatric issue, you would need a psychiatrist, but in general, a clinical psychologist would be able to do an assessment for you and to come up with a formulation of what could be your condition, and then they will point you towards the best type of therapies. Autism in of itself is not a problem. Autism in of itself doesn't need therapy. But sometimes what comes with it is the anxiety maybe that comes with your autism, or depression that comes with your autism. You might have generalized anxiety disorder, you might have OCD, you might have phobias, and also with your autism you might have other conditions like borderline personality disorder, bipolar depression, schizophrenia, any other clinical issue. If it's a thing that it's around phobias and OCD, you're probably looking for somebody who has a specialization in cognitive behavioral therapy. So that's CBT. You'll often hear of CBT as a way of dealing with something like OCD. If it's a thing that you are looking to deal with borderline personality disorder or bipolar depression, or people who have intense emotions that they're really not able to manage their emotions, it overwhelms them, or deliberate self-harm, they would require a therapy called DBT, which is dialectical behavioral therapy. And that's a kind of a combination of CBT, and there is some group work involved, there's some one-to-one, and they bring in other integrative forms of therapy, as well as some mindfulness.